Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
general points or in the diagnosis of um, his in the diagnosis of Mullarian anomalies. In the Mullarian anomalies, the most common Mullarian anomaly is a septate uterus followed by the bicornuate uterus. So, first investigation which is done is transvaginal ultrasonography followed by a hysterosalpingogram. Investigation of choice is actually a 3D ultrasound. Gold standard investigation is MRI. Mullarian malformations can lead to the problems in the pregnancy. Like whenever there is Mullarian malformations, it can result in either a recurrent abortions, especially in the second trimester, or it can result in intrauterine growth retardation, malpresentations, that is breech malpresentations, and preterm labor can occur. Mullarian malformations are associated with the worst reproductive outcome include the worst reproductive outcome in the Mullarian malformations is seen in septate uterus followed by unicornuate uterus. Mullarian malformations associated with the best reproductive outcome include the arcuate uterus. Mullarian malformations associated with renal anomalies is unicornuate uterus, and indication for management in any of these cases is recurrent abortions. Recurrent abortions is the indication for management.
thank you and thank you for watching.